How is cholesterol tested? Have you ever wondered how cholesterol is tested and what those numbers really mean for your health? Understanding cholesterol is essential, especially when it comes to making informed choices about your nutrition. Cholesterol is a waxy substance found in your blood and every cell of your body. Your liver produces all the cholesterol you need, but you also get it from foods like meat, eggs, and dairy. Testing your cholesterol levels can help you assess your risk for heart disease and guide you in making healthier dietary choices. The most common way to test cholesterol is through a blood test known as a lipid panel or lipid profile. This test measures different types of fats in your blood, including total cholesterol, low-density lipoprotein cholesterol, high-density lipoprotein cholesterol, and triglycerides. Low-density lipoprotein cholesterol is often referred to as bad cholesterol because it can accumulate in your arteries. On the other hand, high-density lipoprotein cholesterol is known as good cholesterol since it helps remove low-density lipoprotein cholesterol from your bloodstream. Triglycerides are another type of fat that can raise your risk of heart disease if their levels are too high. To perform the test, a healthcare provider will usually take a blood sample from a vein in your arm. This is typically done in the morning after you have fasted overnight, which means you should not eat or drink anything except water for about 9 to 12 hours before the test. Fasting helps ensure that your triglyceride levels are measured accurately. If you prefer convenience, there are at-home cholesterol test kits available. These kits allow you to collect a small blood sample from your finger and either send it to a lab or use a device at home to get results. While at-home tests can be handy, they may not be as precise as those conducted in a laboratory, especially when measuring different types of cholesterol. Reading food labels is a key part of managing cholesterol in your diet. Food labels provide information on the amount of cholesterol and saturated fat in each serving. Knowing how to interpret these labels helps you make choices that support healthy cholesterol levels. Once you receive your cholesterol test results, you can discuss them with your healthcare provider. If your cholesterol levels are high, there are steps you can take to lower them. This may include modifying your diet, increasing your physical activity, or taking medication if necessary. Making informed choices about the foods you consume, based on what you see on food labels, is a practical way to manage your cholesterol effectively. In summary, cholesterol testing is a straightforward blood test that provides important information about your heart health. Understanding your test results and knowing how to read food labels are essential components of taking care of your cholesterol and overall well-being.